Pulse Protocol is the smart path to medical travel.
Well, hello, everyone. Welcome to this Pulse Protocol webinar regarding Trinity Stem Cell Treatment Center and Clinic. Today, I am your host and moderator. My name is Christian Doing. I am a nurse and I'm a care coordinator for Pulse Protocol, but specifically with Trinity as well. And the purpose of today's webinar is to give you an introduction and an overview and answer some questions, some common questions that potential patients, when they inquire about stem cell treatment, what they have. So thank you for joining us. A little bit about myself. Like I said, I'm a nurse and also a care coordinator. And I have a lot of experience with care coordination in the medical field. And I also have a lot of experience with autism. So that's one of the things that we treat a lot with at Trinity in the stem cells is autism. And it's very near and dear to my heart. And so I'm just feel amazing and blessed to be a part of Trinity with and treating autism because of the gains, as it's known in the community, we're seeing with children. Just the improvement of their quality of life and the families, also how happy they are. So it's a privilege for me. So today we have three of our doctors at Trinity, and I would like to introduce each one of them to you and let them talk a little bit about themselves and what it is that they're passionate about. And so let's start with none other than the medical director of Trinity, Dr. Ana Lara Catan.
Hey, Christian, thank you. And thank you everyone for watching. As you mentioned, my name is Dr. Ana Lara. I am initially from Honduras, currently living in Mexico. I do have a specialty in obesity and metabolic disease and a master's for research, and then I'm certified for cellular therapy. And also, as most of our patients, or at least the patients who know me already know, I focus a lot on the nutrition aspect. So I am a member of the World Obesity Federation, and of course, it's always something that I'm going to encourage so much. And yeah, I'm a medical director here at Trinity, and I am so blessed and excited to be part of the Trinity family, and excited for what's awaiting for us.
Great. And so next we have Dr. Paola Aguilera.
Hi, everyone. My name is Paola Aguilera. I am actually from Guanajuato, Mexico, which is right in the middle of Mexico. But right now I'm living in Ciudad Juarez. I'm working with Trinity. I've been working a few years now with stem cell therapy for different types of diseases. But lately with Trinity, I've been focusing a little bit more on autism, close to Dr. Ana. And well, I'm very excited to be here and meeting you all, working with anyone who wants to or who needs a stem cell treatment for any kind of reason.
Great. And then we also have Dr. Juan Lopez Vega. After you, doctor.
Hello, good afternoon. I'm Alberto Lopez. I'm from Guadalajara, Jalisco, in Mexico. I have a specialty in orthopedic surgery. I currently live in Mexico City, working at the medical unit of high specialty for orthopedic surgery and traumatology surgery. I'm part of the Trinity group. I started working with stem cells, trying to find new ways and new forms to give treatment to the patient for osteomuscular disease prior to surgery, because there's a lot of people that doesn't want to have surgery and try to find some other ways to be treated. So stem cells are a new therapy that is giving pretty great results. So I'm pretty happy to be part of the Trinity family.
Great, thank you. Appreciate that. Appreciate all of you. And so we're going to go ahead and we're going to start addressing some of the general questions that we get. I speak to a lot of families, a lot of prospective patients. I get a lot of these questions. We try to distill all the questions down to some of the most common ones. So we'll go ahead and just get started. And Dr. Lara, if you want to answer these, and then anyone else who feels free to jump in and if you have something you want to add. So our first question would be like, what has motivated you to get involved in stem cell treatment?
So there's a lot of reasons. Mainly as a doctor, I can say sometimes we're not doing enough, or we don't have enough instruments and enough treatment options for so many, different medical conditions, or just for anti-aging properties. As we know, stem cells can help in different ways, in numerous ways. So that's one of the main things, trying to provide a natural and a very good treatment option for so many conditions. So that's one of the main things. I am pro as natural as it can get. And I do know the power of stem cells. I've seen it myself. So it's even more encouraging to know all the stories coming in directly from our patients, getting to see their evolution after treatment. It's just heartwarming, and it's something that, it fulfills my heart and, me as a professional, as a doctor. So just seeing the results we're getting in our patients is more than enough to continue this journey.
Excellent. Does anyone else want to answer that question? Or?
Sure. First, well, there's many reasons too. First, I think I'm a very curious person. So once I started working with stem cells and find out about it, I started reading a lot, and I really think that they are the therapy for the future. And I would really like if everyone or more people could have access to it, because as Anna told you, it's not something natural that can give a lot of benefits. We've seen it with our patients. So I think that's the main reason. And yeah, I think even hope to people that probably didn't have it before. I think those are the main reasons.
Great. Dr. Lopez, did you want to add anything?
Yes, as an orthopedic surgeon, I think my first passion is to be in the surgery room performing surgeries to the patient that needs it. But unfortunately, a lot of procedures that we do in the area of orthopedics are procedures that can give the patient a little bit of relief of their pains, but instead it gives them a little of disabilities to do some stuff, like when we perform a hip replacement or a joint replacement. So I start working with stem cells because I like to give them the opportunity to have a treatment that can help them a lot to get better before trying to go to a surgery that is a way more invasive treatment. So I think it's a good opportunity for the patients to have another options of treatments for their conditions.
Great, thank you. All right, well, that's wonderful, and same with me. I'm super excited to be a part of this as well. As a care coordinator, I get the joy of, as well as the doctors do, but the joy of seeing the families, just light up, and they have amazing experiences, and they're seeing their children or themselves improve with the quality of their life. So that's super exciting. And as a nurse, there's nothing more than we could ask for. And obviously as for physicians as well. So let's go on to the next question. Everyone wants to know, what kind of stem cells does Trinity use?
Yeah, and that's actually a very frequent question, Christian. I always say, just speaking about stem cells is or just mention it as stem cell treatment is very vague, just because stem cell treatments can involve so many different stem cells, so many different ways of performing treatment or origins of the stem cells. So yes, the only type of cells that we use at Trinity are umbilical cord tissue. As I tell my patients, this tissue does have a name. The name is Wharton's jelly. And no, it's not something that's added to the cells. It's just a name of it. It comes up to be a confusion sometimes because of the name. So I always go ahead and just say it like that. It's just the name of the tissue. And there's very different, there's different reasons to why we use them, but especially, and the main reason just being safety. So another thing I always usually say is, we're looking for all the benefits and the gains that we can obtain from stem cells, but our first outcome will always be providing safety. So these type of cells are very safe to use regardless of your blood type, because they're coming in from tissue. There's no hematopoietic markers there. So there's no markers from, that are usually present in blood cells or bloodline cells. So this is the main reason we're using them. Of course, they're considered the gold standard of cell therapy right now. They're extremely safe to use. They're very well tolerated, and we provide them IV. So, it's minimally invasive, as Dr. Lopez was saying. It's another option, and it's less invasive for adults, for kids, especially for kids, because just getting an IV is already a traumatic experience. So, imagine having to go to an OR, and doing intrathecal, which is one of the ways that can be provided, or doing extractions where you have to drill a hole there in the hip, or intravenous or IV treatments are less invasive. It's an outpatient treatment. It's very well tolerated. So we're very happy to be using what's considered the gold standards of stem cells right now.
Great. And so then the next question that arises right after what kind of stem cells is, where do we obtain these stem cells from?
So this is a very long process, and it's also a very frequent question. The cells are obtained from a donor. Okay, so having a donor, it requires a very long process. So, the process basically includes going back to the first trimester of the pregnancy in the mom. So she's going and reaches out to her OBGYN for a medical checkup. This needs to be within the first trimester of her pregnancy. And there are lots of requirements coming in towards, just considering herself a candidate for donor. Some of these requirements are, of course, age. She needs to be within the age of 18 to 25. She needs to be within her first pregnancy. And of course, she needs to consent to donation. Up to this point, she's still not considered a donor. She's a candidate for donor, because after this, there's more studies going on towards, her family history, dad's family history for different medical conditions. There's lots of lab works being done for infectious disease and metabolic conditions, and just making sure she's extremely healthy. And of course, she needs to consent, and she cannot miss any medical appointment, because of course it's a rigorous process where she needs to be in constant communication and constant medical checkup with her OBGYN to make sure the pregnancy is extremely healthy. She also needs to consent for a C-section. I always get the question as to why. It's basically because there can be contamination through birth canal, so we need to make sure the baby is delivered in a sterile environment, in an OR. So she also needs to consent to the C-section, and the pregnancy needs to reach to full term without any complications. As I said, baby needs to be delivered extremely healthy, and that's up to this point, that's when they take the umbilical cord to the lab, where of course, up to this point, they're still not a donor, because there's more exams coming up. So to these cells, there's lots of phenotyping going on. So just to make sure that these stem cells are as pure as they can get, and they express the markers that need to be expressed, and they lack the markers that should not be there. And then, they also run tests to check for oncogenes for, to be sure in the future, there's no risk for these cells to cause mutations and cause tumors. And, in the future, there's no risk for cancer, there's no risk for infection. So there's a lot of testing going on before these cells are prepared, for treatment. So it's a rigorous process.
And so these cells, Trinity obtains them from a certified lab for a certified.
Exactly. Yes. Yes. There's different entities that can certify the lab. Here in Mexico, we have an FDA equivalent. It's called COFEPRIS. So yes, that's one of the main entities that need to certify them. So yeah, COFEPRIS needs to certify them, but then they're also certified under ISO, which are international, international certifications, and everything needs to be done according to the good manual procedures manuals.
Okay, great. So then the next question that would arise would be, how do you check for the viability and know that they are truly, authentic, viable cells?
Yeah, of course. So just to make everyone know how the process goes is, once we schedule you for treatment. So for example, you, Christian, are coming in for treatment in 2 days, right? So cells need to be ordered the day before to make sure that cells have been harvested and used for treatment within 24 hours. So this is one of the things that go into just making sure viability and quality of the cells is there. Also, all of these vials that contain the cells are coming in with a certificate of quality from our lab, where viability is checked every single day. And we do get a report coming in from the lab with viability for that day that they are leaving. Of course, there are other types of testing that these cells undergo. So some of these tests can be, cell viability assessment outside of the culture. So what they usually do is leaving these cells outside for a certain period of time, and then they constantly check, in room temperature, just checking in how viability can decrease within 24 hours, 48 hours, 72 hours, 96 hours, for us to know how these cells behave outside their perfect culture, which I usually tell patients, just imagine it's like a fish in the sea, and it does have the perfect temperature for them, and they're very well taken care of. But then when you put them inside a vial, it's like you're getting the fish and putting it into, a little bag to later go on and move them into a fish tank. So this process and this time is extremely important to just make sure these cells are high quality. So yes, once they leave the lab, they're coming in with a certificate of quality. As I said, viability is checked that same morning before they leave. And then inside our clinic, we do have the cell counter viability machine, but machines are great. They help us a lot, but we also do check with a microscope. So it's not checking for viability with a microscope. It's just, there's more to a percentage of viability coming in from a machine. In my personal, well, in my opinion, or in my personal experience, I'm more of to make sure I need to see, right? So we do have the microscope we connect to, our TV in every other clinics, and we need to make sure the morphology of these cells. So for example, the shape of these cells it looks nice, cells looking nice, round. You can get to see the organelles, you can see the movement going on, just for us to ensure that these cells are high quality and that they are alive, of course. Because it's not only important to know how many cells am I receiving, right? It's also knowing that these cells are alive, because you could be receiving a huge amount of cells, but viability is actually very important. So yes, we do make everything in our hands, and we to provide you with that transparency and that peace of mind for you to know that these are high quality cells, but also you're receiving a right amount, and viability is there, and quality is there.
So even though if they have to be shipped by plane over a day, 24, 48 hours, even 72 hours, they are stored in a way that's going to maintain that viability throughout the whole process, right? The whole way there.
Yeah, they are shipped by a plane. Really, the longest ride is 2 hours, but they are all shipped within a cooler. These cooler contains ice packs, just to maintain the temperature. The temperature needs to be within 2 to 8 degrees Celsius. You use Fahrenheit, but it's 2 to 8 degrees Celsius, and which is basically normal fridge temperature. You know, and this these ice packs, once they reach to us, they're still ice. So you know how they are shipped in, you know, maintaining and being completely sealed and maintaining this temperature. Once they reach to us, as I said, the ice packs are still ice. But then, you know, they're stored in a normal fridge because they are natural, they're not frozen. You know, they're stored in a normal fridge just for ready for treatments. But as I said, you know, we try to provide these cells within 24 hours. And then all of these vials come in with an expiration date for 72 hours, which after 72 hours, it's not like they're dead, but we just don't provide them for our own quality purposes.
Great, thank you. So you mentioned this before, but we'll just ask it again. Well, we'll ask the actual question. How are the cells administered to the patient?
So yes, it's an IV. So as I said, you know, it's minimally invasive, it's outpatient, but more than an IV, it's, which is one of the most frequent questions as well. You know, IV can either be a push or a drip. We provide treatments with an IV push. So all of the cells are going in a push, and a push is directly to the vein, and it's not dripping. So we're not you know, using the cells in a saline or a physiological solution for them to drip over a certain period of time. So actually treatment is very fast. It's a very fast treatment.
Now, Dr. Lopez, you don't use IV, correct?
Yes, exactly. I don't use the IV treatment in the orthopedic field. What I do is to administer it locally. It can be inside the joint, peripheral to the muscle, to the tendon, the ligament, the osteomuscular place that I need to treat directly, because most of the tendons, the ligament, they are not too well vascularized. So we need them to get them right where we need them. So I do local injection. As I said, mostly is intraarticular, right in the joint for disease like osteoarthritis, or it can be for tendon tears, muscle tears. So we can apply right direct in the tendon or in the muscle.
Right, that makes sense. When you have a local issue, that if you could just inject those stem cells directly, locally at the source, instead of having to go through the IV systemically to try to have to find their way there. That makes sense. Thank you for that. Appreciate that.
You're welcome.
All right, and then the big question that any parent of any child especially wants to know, but even, you know, all of us want to know for ourselves, are there any side effects that we need to worry about with these type of stem cells? Dr. Lara.
Yeah, as with any treatments, there can be side effects. However, within the range of treatments, I usually say I consider stem cells very benign. You know, there are common side effects within 24 hours, up to 48. There can be headaches, which are usually more common in adults. You know, it's I usually go and say, you know, with children, we already know hospital settings might be traumatic, but believe me, adults are very scared as well. So headaches are more common with them, but it's, you know, it's within the range of possibilities. And then of course a fever. Remember, your body is reacting to something that wasn't there. So there might be a fever, and that's within 24, 48 hours. And then as with any IV, there can be a bruise where the catheter was, there can be a little swelling. So yeah, with children, it's a very common thing to see. And it's a temporary side effect, but it's, you know, we've had the opposite, but usually it's more concerning, the hyperactivity. So this is a 2 to 3 week, even 1 month. Sometimes we could push it more, but this is like the average of, you know, what we've seen as a side effect is this hyperactivity. I usually encourage, there's no need for medication. There's no need, you know, it's going to go away by itself. There's nothing else that we can do but being patient. However, I do encourage, if there's hyperactivity within this time, to make sure, you know, their son or their daughter are sleeping well, because hyperactivity, of course, can bring lack of sleep, and lack of sleep, even for all of us, and I'm pretty sure there's no exception. If we're not sleeping well, we're cranky the next day. So this lack of sleep can bring more irritability, can bring more, you know, aggression. So we want to make sure that they're sleeping well. And so this is basically the most concerning of the side effects. But as I said, it's temporary, and it's, you know, it's going to go away by itself.
Okay. And didn't you say that it's about 14 days that they live in the body, where some of this can go on for until they start to die off?
Yeah, you know, as with any type of cell within, you know, within our body, there's a life cycle. So these cells also do have a life cycle. It's a more or less, you know, it's, medicine is not a exact science, but it's a more or less time, around 2 weeks. So that's usually matching these hyperactivity, right? You know, this hyperactivity stage or side effect is usually matching this amount, or the amount of the life cycle of these cells. So yeah, they're usually in circulation for around these days. And after that, you know, during this time basically is when they're preparing the environment and making it favorable for regeneration. They're decreasing inflammation, they're calling more cells, but usually our cells are the ones who are going to do the big job, or are going to do all the work within the following weeks and even months.
Great, thank you. And another big question that I get all the time is how many cells are my child or myself going to receive? I always tell them, you got to talk with the doctor about that. It's customizable to each individual. So
yeah, and I'm going to also ask Dr. Paola on this to help me out, because yeah, it's you know, it's not a cooking recipe like you need to measure everything and that's it, right? No, it's a more personalized approach. We can say that we're within a range of 2 million per kilogram to 3 million per kilogram, but of course there's a lot of things we need to take into consideration when we are you know, trying to provide a treatment protocol that's more suitable for every person. So this is something that we usually discuss with them, you know, to make sure that not only are we providing a good amount of cells, but we're also within a range that's proven to be safe. Of course, sometimes I say, you know, I'm not concerned much about safety, but however, we really need to have evidence towards what we're doing, of course, because we're not doing clinical trials within any of our clinics. So even though sometimes patients do want more, because we know how stem cells can work, we can only provide treatment within this range. But to determine the amount within this range, we need to take different factors into consideration. So not sure if Paola.
Yeah, we need to consider weight. We need to consider their background, because that also affects the amount of cells, or it's something else could work, probably a higher dose, or the opposite, less dose. We need to consider if it's their first treatment, or if they've had some other treatments before, how they handle them when they get a treatment. So it's not something that we can just see the patient once and decide. we really have to talk to them and dig into their medical history. And well, yeah, as Dr. Anna said, it's not a cooking recipe, so that's important.
It also depends on you know, the condition you're looking for. You know, if you want stem cells, why do you want stem cells? So it's all directed towards that. But yeah, we do need to take into consideration so many different things. With Dr. Lopez, we were also discussing this past weekend, you know, in athletes especially, how do you determine? And if they are pro athletes, we also need to consider, you know, the restrictions towards USADA or WADA, or so there's a lot of things going on where sometimes we cannot even do IV treatments and we need to stick with local injections and all in Dr. Lopez patients. But you know, it's a lot to take into consideration. So that's why we usually ask for different documents and medical forms and diagnosis as well.
Okay, and then the only other really big question that always comes up is, of course, cost. So we have what are called like quote packages for various different types of treatments of what we're trying to treat, and each package has its own cost. So if you want to mention a couple of the most common packages and what that includes and what that price would be.
So yeah, I would have to say that it will all depend on the treatment protocol. But what I can say is all of these packages do contain transportation across the border, or you know, just land transportation if you're flying into one of our border clinics, if you are flying into the US city that's across from the clinic. So we do provide transportation. There's also a consultation that's included in each of the packages. And then just to give you an overview, for example, for children in the, you know, autism package, we are providing exosomes, which is something that we did not discuss, but to give you an idea, the exosomes are cells byproduct, so it's just like a booster to our treatment. So we're providing these exosomes, and then we're providing the treatment with cells according to their weight, medical history, and everything we discussed right now. The cost for this is $4,900 as of 2021. And then to give you another example, for adults, we have, a package for 200 million cells and as umbilical cord tissue cells. And of course, we're also providing exosomes, and we're also providing IV vitamins for a booster of energy, and just providing and helping these cells enter a very favorable environment with our bodies. The price for this as of 2021 is $7,900. All of these packages and costs do have financial options, which are available for everyone. So, we understand it's sometimes any medical treatment sometimes it's difficult because it also involves traveling. So we're trying to help in the best possible way.
Right, so those packages do not include hotels, reservations, or airfare. So those are things that you as the patient or family, you have to make those accommodations for yourself to find your way close to the border on the US side for the clinic to then send the professional driver service, which is included in the package, to come pick you up at your place of choice, your hotel, or even at the airport if you wanted to arrange that, for them to escort you across the border to the clinic and then back. So that's separate.
That would be separate, and that's more towards our border clinics, but we are opening new clinics with basically flight options. So if you want to fly in directly, we will have a clinic in Monterey which has an international airport. And of course, transportation will be included there as well towards, airport, hotel, clinic. But yes, transportation is included, hotel, and of course, flights are not included. And the hotel reservation as well. But we are in the best available, we're willing to help in the best possible way. If you do have any questions, if there's any other way that we can help you with, we are going to try our best to help you.
Yeah, and I'd like to add that, talking with parents, this comes up a lot. Why are we so affordable? And one of the main reasons is, other than philanthropy, donations, but apart from that, Trinity has been set up to be convenient and affordable for families in the US and Canada and around the world. And they're not, a lot of medical travel is in Mexico is very big, pro vacation, like have a vacation while you come for your treatment, in resorts and, these exquisite areas. It's not necessarily the case with ours. We're not, most parents aren't looking to vacation to get their child treated for their autism, or other people coming for, other various orthopedic and other, disease reasons. People just want to get in and get out and go back home. And a lot of parents really appreciate that they're not forced into some kind of vacation, expensive, type of deal. So, and it's nice that a lot of our clinics are so close to the US border, making it easy and convenient for families to get in and get out. So just wanted to mention that.
Yes, it's very important to mention it, sorry, because also not only patients with autism, but also patients that have a lot of pain or other conditions, sometimes they are not able to fly, so they have to be driving. So we want to offer you that convenience, but that is very important.
Yeah. Well, that's it for questions. I think that's a wrap. And doctors, I appreciate your time and being so generous in your answers. And I just want to say to everyone out there that is on the fence or is interested, inquire. And there's a good chance you might get me. If not, you'll get another nice coordinator, someone that can be a bridge to help link you to the clinic and to these fantastic doctors. They are, as of now, offering complimentary up to 1 hour Zoom video consultations. So get your notebooks out, write down all of your questions. Don't rely on your memory, because whenever people think that they're going to remember their questions, they get in front of the doctor and then they start to go blank. So keep your little medical journal of questions. Inquire. You'll get to talk to someone like myself. We'll just get your medical history. We'll go over some things, answer some questions, and we'll connect you with the doctors for a consultation, and we'll go from there. So doctors, thank you again. I appreciate your time. And on behalf of Pulse Protocol and Trinity Stem Cell Treatment Clinic, thanks for joining us. Take care.
Thank
Have a great
you.
time.
Take
Bye.
care.
Have a nice day.